intervention. Secondary observations included reporting of any observable side effects such as nausea or headache. The data was collected at the patient's bedside using a paper data collection tool that was adapted with permission from Jones et al. It was then entered into the REDCap software for data management. The paper data collection tools that remained after it was entered into REDCap were stored in a locked private office. So this is the meat and potatoes of what we found. This is the data analysis and the results. So you'll see here a table that has all 11 participants, and it has their pre-session pain rating and their post-session pain rating. So as you can see, the mean pain rating before the session was a 6.68 with a range of 2 to 10. And the post-session pain rating, the mean was 3.36 with a range of 0 to 8. So if you look at the averages there, it essentially cut the patient's pain in half from about a 6 to a 3. 100% of participants did report a reduction in pain following the pain intervention. The mean reduction in pain was 3.5 points with a range of 0.5 to 7. Due to the relatively small sample size and the ratings range that we used, the data was analyzed using a Wilcoxon matched pairs test through the SPSS statistical software at a 0.05 level of significance. The Wilcoxon matched pairs test revealed statistically significant findings with a decrease or reduction in pain-rated pain control scores for the use of VR. Furthermore, no patients reported any significant side effects or adverse effects. So no one had any facial pain, dizziness, nausea, headaches, or any complications from the use of VR. So this is just a slide that shows you the output from SPSS that shows the significance level and that we should reject the null hypothesis and that these are statistically significant results. So the outcomes of this pilot study demonstrate the potential application of VR-based guided meditation as an effective non-pharmacological pain control intervention for people with difficulty managing pain associated with pre-existing opioid abuse, dependence, or tolerance. Completion of a 10-minute guided meditation through the Calm application did result in a statistically significant reduction in pain for all participants. The Chicken Little and the Snow World, which is mostly what is in the literature now, versus the guided meditation VR, since those are different. And it'll also be great if we could identify if the use of these VR interventions can do things like reduce opioid consumptions or have other positive patient outcomes, such as maybe they can reduce anxiety or improve physical function or even improve length of stay, since we know patients with opioid problems have problems with all of those. In the area of dissemination, my initial research findings were provided to my DOP committee, to the nurse manager, educator, and those wonderful nurse practitioners on the participating unit to give them some information. The full scholarly project report is being presented today, and it will also be provided to the nursing leadership of the participating organization. And I would also like to submit an abstract regarding this project and a written manuscript to Pain Management Nursing, which is the official journal of the American Society of Pain Management.
Jennifer, I'm not sure if you can see the...
Is it okay if I stop sharing my presentation so that I can see WebEx again? Okay, I'm going to click stop sharing so that I can see everybody.
Yeah, okay. And if you need me to, I'm happy to read the comments, or you can...
Oh, beautiful. I can see everybody now. Let's see what it says.
It's from Dr. Torres. She says, this is one of the first studies I've seen done during the pandemic. Did you have any difficulties?
Dr. Torres, what a great question. I had really significant difficulties because of the pandemic. So I was unfortunate enough that my IRB application was approved the first week of April, which was the same week that they shut down all research at UMC. So I had to sit on my hands until September when they started to slightly lift the visitor restrictions in the hospital. Also, I had to come up with an explanation of how, because my device was reusable and it was going from patient to patient, I presented the nurse manager on the floor of, here's how I will clean this device in between patients. I will be happy to supply my own masks and PPE and whatever I need to see patients. I will get done. So yes, I had pretty significant COVID-related restrictions. It put my data collection back for several months.
Relatively small sample size.
Yes.
That's the final thing. You're going to submit an abstract, to the conference, and also have a plan to translate, to a manuscript and submit it to the Penn Management magazine. I feel this is wonderful, especially, for school nursing. Now the dean try to promote and expand related to the research, the scholarly work. So not only the PhD student I feel, in the future for the DMD, this is a good way to go. And not only present, but also we have some plan to present the conference and also to have a manuscript developed. Thank you.
Thank you so much. I see a note in the chat box from somebody about laboring patients, Debbie. There is actually some pretty good literature out there for women in labor and delivery using VR. Not this particular intervention, but there's definitely some out there that I found in my literature reviews that I can send to you guys. Yes.